Arthritis, an illness that causes the parts of the body where bones meet to become painful and often big. Pain and swelling in the joints of the body. Living with arthritis. Jane had always been an active person. She loved gardening, going for long walks, and playing with her grandchildren. But over the past year, she started noticing pain in her joints, especially in her hands and knees. At first, she thought it was just part of getting older, but the pain didn't go away. In fact, it got worse. One morning, as she was trying to open a jar, she felt a sharp pain in her fingers. It was then that she decided to see a doctor. During her appointment, the doctor listened to her symptoms and examined her joints. "Jane, it sounds like you might have arthritis," the doctor said. "Arthritis is a condition that causes inflammation in the joints, leading to pain and stiffness. It's quite common, especially as we age." The diagnosis made sense to Jane. She had heard of arthritis before, but didn't realize how much it could affect daily life. The doctor explained that while there's no cure for arthritis, there are treatments that can help manage the symptoms. He recommended some exercises to keep her joints flexible, prescribed medication to reduce the pain, and suggested a few lifestyle changes. At first, Jane felt discouraged. She worried that arthritis would prevent her from doing the things she loved. But she was determined not to let it control her life. She started taking the medication as prescribed and followed the doctor's advice on exercise. She also learned about different ways to manage arthritis, like using warm compresses on her joints and avoiding activities that put too much strain on them. Over time, Jane noticed that the pain became more manageable. She still had days when the arthritis flared up, but she didn't let it stop her from enjoying her life. She found new hobbies that were easier on her joints and even joined a support group where she met others living with arthritis. Jane realized that while arthritis was a part of her life, it didn't define her. With the right care and positive attitude, she could still do many of the things she loved. And most importantly, she learned to listen to her body and take care of herself. Asthma, an illness that makes it difficult to breathe, an illness which causes difficulty in breathing out, resulting from an allergy, etc. Managing life with asthma. Mark had always loved sports, especially playing soccer with his friends. But over the past few months, he noticed something unusual. Every time he played, he would start to feel short of breath. His chest would tighten, and sometimes he'd even start coughing and wheezing. It was getting harder to keep up with the game. One day, after a particularly tough match, Mark's breathing became so difficult that he had to sit out for the rest of the game. His friend, who had asthma, noticed what was happening and suggested that Mark see a doctor. Mark took his friend's advice and made an appointment. During the visit, the doctor asked him about his symptoms and did a few tests. After listening to Mark's breathing and checking his lung function, the doctor gave him a diagnosis: asthma. Asthma is a condition where the airways in your lungs become inflamed and narrow, making it hard to breathe, the doctor explained. It can be triggered by exercise, allergies, or even stress. Mark felt worried when he heard the diagnosis. He didn't want asthma to stop him from playing sports. But the doctor reassured him that many people with asthma lead active lives. He explained that with the right treatment, Mark could manage his asthma and continue doing the things he loved. The doctor prescribed an inhaler for Mark to use before exercise and whenever he felt an asthma attack coming on. He also gave him tips on avoiding triggers and what to do if his symptoms worsened. At first, Mark was nervous about using the inhaler and managing his asthma, but after a few weeks, he started to feel more confident. He learned to recognize the early signs of an asthma attack and used his inhaler as instructed. With the medication, he could play soccer without worrying about his breathing. Mark's asthma didn't disappear, but it became something he could manage. He realized that while asthma was a part of his life, it didn't have to control it. With the right care and a few adjustments, he could still enjoy the sports he loved. Bacteria, very small living things that sometimes cause disease. Understanding bacteria. Sophie loved spending time outdoors, especially hiking in the woods near her home. One weekend, after a long hike, she noticed a small cut on her leg. It seemed like nothing serious, so she cleaned it quickly and didn't think much more about it. Sophie loved spending time outdoors, especially hiking in the woods near her home. One weekend, after a long hike, she noticed a small cut on her leg. It seemed like nothing serious, so she cleaned it quickly and didn't think much more about it. A few days later, Sophie started feeling unwell. The area around the cut became red and swollen, and she developed a fever. Concerned, she went to see her doctor. After examining the wound, the doctor told her that it was infected. "It looks like bacteria have entered the cut and caused an infection," the doctor explained. Bacteria are tiny organisms that can cause infections when they get into your body, especially through cuts or open wounds. Sophie was surprised. She didn't realize how easily bacteria could cause problems. The doctor explained that bacteria are everywhere, on surfaces, in the air, and even on our skin. Most bacteria are harmless, but some can cause infections if they get inside the body. To treat the infection, the doctor prescribed antibiotics. "Antibiotics help kill the bacteria causing the infection," the doctor said. "It's important to take the full course of antibiotics, even if you start feeling better, to make sure all the bacteria are gone." Sophie took the antibiotics as prescribed, and within a few days, the redness and swelling started to go away. She felt relieved that the bacteria were being dealt with, but she also realized how important it was to take care of even small cuts to prevent infections. From that experience, Sophie learned to be more cautious. She made sure to clean any cuts thoroughly and cover them with a bandage to keep bacteria out. She also became more aware of the role bacteria play in our health, both the good and the bad. Thanks to the quick treatment, Sophie's infection cleared up completely. She was glad she didn't ignore the symptoms and sought medical help when she did. Now, she knew that even though bacteria are small, they can have a big impact on our health. Bed sore, a painful place on the body caused by having to lie in bed for a long time. Preventing bed sores. When Helen's mother, Mrs. Johnson, was admitted to a nursing home after a hip surgery, Helen was relieved to know she would be well cared for. The nursing home staff were experienced and professional, and Helen felt confident that her mother was in good hands. However, a few weeks into her stay, Helen noticed that Mrs. Johnson had developed a sore in her lower back. The area was red and painful. Concerned, Helen asked one of the nurses about it. The nurse explained that the sore was a bed sore, also known as a pressure ulcer. Bed sores occur when a person remains in the same position for too long, putting pressure on certain areas of the body. This pressure reduces blood flow to the skin and tissues, leading to sores. Helen was surprised. She knew her mother was bedridden for most of the day, but she didn't realize how important it was to move her frequently to prevent bed sores. The nurse reassured Helen that the staff were taking steps to manage and prevent bed sores. They were adjusting Mrs. Johnson's position regularly and using special cushions to relieve pressure. The nurse also explained how they would treat the existing bed sore with proper wound care. Helen was grateful for the information and wanted to ensure her mother's comfort and health. She learned that to prevent bed sores, it was crucial to 1. Change positions regularly, moving the patient every few hours to reduce pressure on any one area. 2. Use supportive devices, special cushions and mattresses that help distribute pressure more evenly. 3. Keep the skin clean and dry, regularly checking for any signs of sores and keeping the skin clean and free from moisture. Helen made sure to communicate these points to her family and the nursing home staff. With everyone's efforts, Mrs. Johnson's bed sore began to heal and the risk of new sores decreased. This experience taught Helen the importance of preventing and managing bed sores, especially for people who are unable to move easily. She was thankful for the nursing home's care and felt more informed about how to support her mother's health. Benign, pleasant and kind, not harmful or severe, of a disease or tissue growing because of a disease, not likely to result in death. A scare with a benign outcome. When Maria found a small lump on her neck, she couldn't help but worry. It felt strange, and she didn't know what it could be. The more she thought about it, the more anxious she became. After a few days of worry, she decided to see a doctor. At the appointment, the doctor examined the lump carefully and decided to run some tests. Maria felt nervous as she waited for the results, imagining all sorts of scary possibilities. A few days later, the doctor called her back to discuss the findings. "Maria, the lump you found is benign," the doctor said with a reassuring smile. Seeing the confused look on Maria's face, he continued, "Benign means that the lump is not cancerous, it's not harmful, and won't spread to other parts of your body." Maria felt a wave of relief wash over her. She had been so worried that it could be something serious. The doctor explained that benign tumours are quite common and, in most cases, don't require any treatment. However, he recommended keeping an eye on it and coming back if it changed in size or caused any discomfort. As Maria left the doctor's office, she felt much lighter. The word benign was now a word that brought her comfort instead of fear. She was grateful that the situation wasn't serious and that she could continue with her life without any major concerns. From that experience, Maria learned not to jump to conclusions when it comes to health issues. She understood the importance of seeing a doctor and getting the right information rather than worrying about the worst-case scenario. And most importantly, she was grateful that her situation had a benign outcome.